Okay, so good afternoon, everyone. Good afternoon. Okay, so today is the last lecture before the midterm, and tomorrow you have a formative quiz. Hopefully, you will have to do great job there, and then day after tomorrow we'll do one quiz session or some review session before the midterm exam. Okay, so we started the cestode parasites, and we covered the most important one yesterday, like Taenia species, Echinococcus. Those are the important one in the case of cyclophilidine group. So today we'll continue with the cyclophilidine group, but this time we will be covered the arthropod transmitted cestode in this group. Yesterday we covered those who the intermediate host is mostly the ruminants. So here Diphyllidium caninum, Anapocephala, and Monasia expensa. So these are the three most important arthropod transmitted cyclophilidine type of cestodes. The definitive hosts are dogs in the case of Diphyllidium caninum. In the case of Anapocephala perforata, horse is the definitive host. In the case of Monasia expensa, cattle and sheep is the definitive host. And both cases, the arthropods like flea and mites are the intermediate host. So let's start with the Diphyllidium caninum, the most common tapeworm of dogs and cats. Intermediate host is the cat flea. However, the transmission is never be happen by the biting of these flea to the host. It's always the ingestion of these flies by the host. So that's the most important point you have to remember for the transmission of this group of parasite Diphyllidium caninum is through the ingestion of the flea instead of flea bite to the host. Normally, not a very common clinical sign will be seen up, but sometime you will see some chronic enteritis or some vomiting or some pruritus. It has a zoonotic concern, but is very rare. Especially, it is seen in the children, but is asymptomatic. And the worms in the child feces, you will be see these worms, but is asymptomatic disease in the child. So I will let you know in the next slide how the child will be infected. So one important point, you can see this the eggs. They are completely different. The one you have seen in the previous lecture of Taenia and Echinococcus. So these eggs, this is a big shell of the shell where you have seen the small eggs, and each eggs contain the hooks like these hexagon type of hooks will be seen in these eggs. So that's a difference here. The eggs are different here. So the life cycle. Dogs are the definitive host. Pre-patent period is 1 month, and these cestodes, Diphyllidium cestode in the intestine, they will be produce eggs, and the eggs, they have a pocket containing a number of eggs inside, and these eggs come out in the environment where this flea will be taken these eggs, and inside of the flea, cystocercoids. So again, go back to the yesterday's lecture. where we talked about the cystosarcoids. So what these cystosarcoids are? Anyone? Sorry? Larval stage. These are the metacystodes in the flea, and cystosarcoids, they always have a single protoscolex. So this flea will be ingested by the dog, and the life cycle get completed. Sometime, in a very rare time, is eaten by the children's. These flea is very rare, but it's happened sometime. So the case has been seen. So that's the way this disease is transmitted in the human, but it's a very rare situation. Okay, so diagnosis. Sorry. So diagnosis. So normally you will be see in the feces the segments of the proglottides. So you will be see these one here in the feces, and then one of the best method is to take this segment and squeeze it into the petri dish, and the eggs will be start releasing from the from there. And this is one of the way you can have to see the eggs. To see these segments are longer than they are wide. They are cucumber seed-like shape, and you can able to easily first diagnose based on the to see the feces that there is something happen as far as the cystode infection is concerned, and diphylidium, one of the example for the dog. But definitely in the case of tinea and echinococcus, you will also see the segments, but maybe that is one of the other example. So the best way is to look it into the eggs. So what you're going to you will be see how you can differentiate or distinguish the tinea, echinococcus, or diphylidium egg. So you can able to differentiate. You don't need a PCR here, right? Am I right? So look it into this. Teneid type of eggs, either tinea or echinococcus, and look it into this diphylidium, easily differentiable. So you can differentiate the eggs based on the morphology here. This is a diphylidium egg, or this is a teneid type of eggs, including tinea or echinococcus. Okay, so further, the proglottides, as I showed you in the previous slide, they pass into the feces. Normally, eggs are not usually seen in the feces, but if you want to see the eggs in the feces, what is the best method? Sedimentation or fecal flotation, right? So proglottides, they may burst open and they release the eggs pocket. The eggs contain these pockets contain a multiple eggs, and these each egg has a hook called oncospheres, and the eggs pockets are seen in the fecal flotation if you perform that one, and if you find that one there. But the other option is to be take out these segments of these tapeworms and then squeeze it. If you see the proglottides in the feces, you can confirm the diagnosis by squeezing and preparing these and take it out the eggs from these squeezed proglottide segment. So this is how you can able to diagnose these diphylidium caninum eggs from the feces. So treatment, praziquantel or epsiprentol, these are the two labeled drugs used for the control of diphylidium caninum. However, the retreatment is necessary. Why we need it? Once we treat the animals with this praziquantel or epsiprentol, you have to do the retreatment plan. Why? What do you think? Sorry? Fleas are still around. So you will see the fleas, because you can't eradicate the fleas. Fleas should be around. So in that case, the flea treatment should be the part of your treatment plan. And this drug resistance is reported, but is not a big problem at this stage. There is some few treatment failures calls has been received in a number of different veterinary clinics, but is not a big problem at this stage. Okay, so we covered this Diphylidium caninum, that is the dog. Definitive host is dog and cats, but in Anapocephala perforata, these are the most common parasite of horses, and the worms are normally reside into the ileocecal junction, and that is responsible for the impaction and interception of the ileocecal junction. So if that is happen, what will be your diagnosis here? What do you think? What will be the next you will be expect? Sorry? Colic. So that will be expected. So risk will be there for the colic. Yes.
Are these the adult worms or the larvae that are?
These are the adult worms. So next I will show you the life cycle. Then it will be more clear. So these are the adult worm, tapeworm, right? So risk of the colic will be there. So what you will be going to see in the horse? So you will be see these tapeworm, adult worm in the horse, ileocecal junction, pre-patent period 1 month, and then these will start releasing these eggs, and now you can see the eggs shape are completely different as compared to Taenia or Echinococcus. So they are piriform or D-shaped egg. And if I'm trying to remember, in the last this lab, someone has seen these type of eggs in the fecal flotation. Am I right? I've seen one group has seen this egg, and you have seen, right? Yes. So this, but I will show you which you have seen in the next part of the lecture. So you will be see these eggs sometime in the feces, but very, very low in number. So as far as the pathology, it will be you will be see the eruptions of the intestine as shown here, and you will see these segments of the cestodes here, the preglottide segments, and some studies have suggest that due to the impaction, the risk of the colic will be there, and it will be if you have like more than 20 worms, they will be block the large intestine, and that will be responsible for colic in horses. So what is the outcome here? We get it into this in the clinical features. In the case of Taenia and Echinococcus, the infection is asymptomatic in the definitive host. But here you can see in the definitive host, sometimes you will see a very severe sign of colic. Right? So that's the important point. So you have to remember that the severity of the Anapocephala perforata in horse is severe. So diagnosis, you will be see this D shape with piriform apparatus. This is the piriform apparatus somewhere in the middle. So egg will be float well, but usually will not see eggs in the feces. If you see, with a very few in number, eggs will not directly shed. So the proglottides, they should be break off, and then they come out along with the feces, and then the eggs will be released from these proglottides with the squeezing of these proglottides. So if the eggs will be seen in a sample from a multiple horses, then you will be suggest that this is the herd problem. Other alternative will be the ELISA that is available to diagnose this one, and PCR may be one of the other option. But definitely you can easily identify these piriform D-shaped eggs in the fecal account or the squeezing of the proglottide segments. Okay, so the treatment plan. So praziquantel and the dose of parental is the best treatment of choice. Also, the praziquantel is sold along with the ivermectin and moxidectin, so that is also another option. And both should be effective, but the praziquantel is little higher efficacy in the treatment of the Anaphocephala perforata. So then perform the fecal examination after the use of these drugs to improve the detection of the eggs, and then it will be helpful for the recommendation for this disease surveillance program. Why you need to do the fecal examination after the treatment? Sorry? Say it again? No, once to treat it, after that, why you need to perform the fecal examination after 24 hours or something like that to see if the treatment work or not. So that's the reason you have to do the fecal examination. In heavy infection, as I said, colic one is one of the option there. Okay, so what you have seen in the fecal sample in the last lab, that is Munesia, because Munesia is commonly seen in ruminant. The eggs are very similar to Anaphocephala, but you can easily differentiate because Munesia can't be affect horses and Anaphocephala can't be infect ruminant. So if you find this type of eggs here in the case of ruminants, so you can easily say this is Munesia expensa. And if you see this type of deformed shape of eggs very similar to that one in horses, that is Anaphocephala. So in the ruminants, tapeworm, they can cause infection in the intestine, and they will produce eggs here, and these eggs will be taken by the arthropod host, and again these are cysticercoids, single protoscolex, and that will be eaten by the definitive host, and the life cycle get completed. Okay, so for the diagnosis, eggs in the feces, you have seen that some of the group have seen these type of eggs in the feces in the last practical. Proglottides also seen in the feces, and the treatment is because this disease is not very much pathogenic or cause a severe infection, so treatment is usually not indicated. But if you need to treat especially the young animals with heavy infection, fenbendazole or albendazole is the drug of choice. Okay, so let's do some knowledge check questions here, some review, and see where we are based on what we have covered today. Okay, so you have seen the horse with mild colic and found the falling eggs in the feces. What is your diagnosis? Okay, so Nepocephala perforata. If you see these type of eggs in cattle, then you will be make your diagnosis that this is Munisia expensa. But these type of eggs is only seen either in horses as well as ruminants. But Diphylidium caninum, the eggs are completely different. They have much bigger, small eggs within the big shell, and that is completely or easily differentiate from Taenia and Echinococcus. Okay, so the last part we will be covered this aquatic transmitted cestode, and these belongs to the pseudofelidine type, and we covered the two most important aquatic transmitted cestode, that is Spirometra, monocyanocytes, as well as Diphyllobothrum lectum. So these two pseudofelidine type of cestode will be covered in this part, where you will be see the definitive host is dogs and cats. First intermediate host is copepod, and the second intermediate host is fish. So previously we covered the cyclofelidine group, where you have seen how many intermediate host? One intermediate host. So in the pseudofelidine group, there is a two intermediate host, and one is copepod and other is fish. So Spirometra, normally seen in southeastern USA. Dogs, cats are the definitive host, and sometimes bowcat or raccoons is also act as a definitive host, and this disease is transmitted and they are linked with the aquatic habitat. So how it linked with the aquatic habitat? First intermediate host is the copepod, where from the copepod, fish, rodents or snakes, they can be taken one of the larval stage from the copepod, and then develop into the next larval stage as into the fish, snake or rodent. They act as a second intermediate host. So these second intermediate host is further eaten by the definitive host to be complete the life cycle. So usually the clinical features are asymptomatic, but sometimes you will see the infection in the small intestine that will be further responsible for the diarrhea, vomiting, and weight loss. Not a very severe sign, so you will be see these type of minor sign, and because normally it is asymptomatic infection. Okay, so who gonna explain the life cycle of Spirometra to us? Any volunteer?
So the cat or dog comes up the egg, uncreated egg, and goes in the water.
So just a little bit. So egg are in the water. So most important point you have to tell us what the eggs will be look like. So look it into here. Operculate egg. So what is the important point to remember if you say operculated egg? What's the important point with the operculated egg? So where we talked about the operculated egg before? What? Sorry? Trematode. So they are very similar to trematode. So that's the point. Remember this point. So these are very similar to trematode. Yes? However, if you see the egg in the fecal flotation, what your diagnosis is? Sorry? That will be a cestode. If you see the eggs in the sedimentation, your diagnosis will be trematode. Remember this point. This is a very important point. Okay? So, next, operculated egg.
So it becomes goes into a copepod, which gets eaten by either rodent.
So, it converted into procercoids. That is the metacestode or larval stage, first larval stage. From here, next.
Then it goes to a fish, rodent, or snake, becoming pleurocercoid.
Not the procercoids. Copepod eat these along with the procercoids. Right here, and then the next stage will be procercoids. These are the second larval stage, and from here, the dogs and cat eat, especially the fish, raw fish, and the life cycle complete. And human can also act as a definitive host, and once they eat the fish. So this is how the pseudofelidine life cycle, either in case of Spirometra or in the case of Diphyllobothrum. So once it is eaten by human, what is going to happen? Sparginosis. That is the disease caused by the ingestion of these procercoids, and sometimes the procercoids by the human, right? So what happened? The people can be infected, or human can be infected with the contaminated water. They have sometimes copepod, first intermediate host, or procercoid from the second intermediate host. And what has happened? These are the clinical sign, or the lesions will be seen in the skin, that is subcutaneous nodules. So that's called sparginosis in human. So little bit a severe infection in human, and this nodule formation will be seen in the skin. Okay, so in the case of Diphyllobothrum lectum, that is also the aquatics are the intermediate host, is called fish tapeworm. This tapeworm also has a zoonotic importance. Dogs and cats are the definitive host, but as far as this tapeworm, fish tapeworm, has a zoonotic concern, more than 20 million people has been infected worldwide, and normally this is one of the major problem in the Hampshire region around the world, and different lakes, and in Scandinavian country that is one of the massive problem in the fishermen's. Okay, so what the eggs will be look like? So here is the Diphyllobothrum lectum eggs here. So again, operculated type of eggs, and remember we in the yesterday's lecture, in the very beginning, I show you the head part of the pseudofelidine type of group, and you will see the slit or grooves is not like a hook or the hooks will not be seen, is a groove shape or slit shape, but the body will be similar. In the case of you will see the proglottide segments in the rest of the body of this parasite. So now someone else can be explained to us this time the life cycle of the Diphyllobothrum. Who else will be? Anyone else? Anyone? Any volunteer? Yes.
And then now you've got these operculated eggs chilling out here.
So definitive host will be
Dog or cat or human.
human. Yes. Great. Next.
Now you've got these operculated eggs out here in the water, and then your first intermediate host is going to ingest those in the procrit void, and then that is the first larval stage, and then the second larval stage that'll happen because the second intermediate host will ingest the copepod, and then once that is eaten, the second intermediate host is eaten by the definitive host.
Yes. So normally the fish is the second intermediate host that is eaten by the human, dogs, and cats, and the life cycle will be complete. Great. So what happens if the human can be eaten these Diphyllobothrum metacestodes or larvae from the fish, because fish is the second intermediate host, and the prevalence is really high in the second avian fishermen, because they eat a lot of raw fish, and that is one of the reason having the transmission of this disease into them. Okay, so let's start with this question. The copepod and fish are the first and second intermediate host of the following cestodes. Okay, so Spirometra and Diphyllobothrum. So these are the two pseudophilidine group where you will be see the copepod and fish are the first and second intermediate host. Okay, so you have identified the falling eggs in the fecal flotation. What is your diagnosis? Okay, so Diphyllobothrum. As I said, Diphyllobothrum and Spirometra, these are the two cestodes of pseudophilidine group. The eggs are very similar to trematode. They are operculated type of eggs. Okay, so what we covered yesterday's and today's lecture. We covered this cyclophilidine eggs, for example, like Taenia or Echinococcus. They are thick, shelled, single egg, as shown here, and the hooks are oncosphere. You will be see in the middle of these eggs. We covered the Diphyllophilidium, and the eggs will be pocket. They have a pockets, and the eggs are inside. So we covered the Monesia and Apocephala. They are very similar in shape, like piriform or D-shaped, irregular shape, but you will not see. They are host specific. Monesia always infect cattle, or Apocephala always infect horses. So we also covered this pseudophilidine eggs. And we differentiate based on the cyclophilidine eggs of Taenia or Echinococcus. In the case of pseudophilidine, the eggs are operculated. So which two pseudophilidine species or cestode parasite we covered today? Spirometra and Diphyllobothrum. So these two cestode parasites have a operculated eggs. So as far as the pathology, adults are always in the definitive host, and usually you will see the asymptomatic infection in the case of the Taenia or Echinococcus or Diphyllidium, Monesia, Anepocephala. But in the case of Anepocephala, you will also see a risk factor of colic. And here you can see the pathogenesis of the pseudophylidine group in the definitive host. For example, they are associated with the disease when the large number of worms are present, and you will see the clinical features here in the case of Spirometra or in the case of Anepocephala. As I said, the colic is one of the example here, and sparginosis is the example in the case of Spirometra in human. So the larvae are the most important stage, especially in the cyclophylidine group, because they cause a very, very severe disease in the intermediate host. So you remember that yesterday we talked about the ruminants cause a very severe disease once they infected as an intermediate host, and the number of different organs, the different type of metacestodes developed in the different organs of the ruminants based on the species, what species has been infected and which particular organ has been involved once that species has been infected the ruminants. So the disease type will be depend on the location, which organs has been involved, what is the size of these cysts, number of these cysts. So these are the number of different points you have to be remember, that how commonly these intermediate hosts will be infected with these larval stages of these tapeworm. Okay, so we covered the treatment plans. The praziquantel, that is normally used in small animals, as well as epsinoparental, that is also used in the small animal. Praziquantels is also used in horses. For example, which particular cestode infection in horses? Praziquantel is a drug of choice. Sorry? Anepocephala. Anepocephala perforata. In the case of Taenia and Monesia, fenbendazole is also drug of choice. In the Monesia, albendazole is also is work, as well as the praziquantel. Parental is the combination along with the praziquantel is also used in the case of Anepocephala perforata infection. So the control strategies, that is important. In general, the treated form dogs with anthelmintic every 6 to 8 weeks. So the dogs, those who are in the forms, should be treated every 6 to 8 weeks. So, and these dogs should be confined for 48 hours after the treatment. Why? Why we let them away from the ruminants after the treatment, 48 hours after the treatment? Sorry? They shed eggs. What else they shed other than egg? Sorry? Proglottides, the segments of these tapeworms. So that is one of the source to be take these one from the eggs will be taken by the intermediate host, in the form. So that's why they are confined. And once the intermediate host like sheep or ruminants will be infected, especially in the case of Taenia and Echinococcus, euthanasia is the only option. There is no treatment of choice in that case. So the only choice is to go with the euthanasia. So you can prevent the dogs from defecating into these sheep feed. That is one of the source there. So don't try get these dogs access to this sheep carcass. Again, there's a two-way traffic here. So once they take the cyst from the metacestode from the ruminants, so infection will be moved toward the dogs. So that's why both sides you have to be covered. You have to be dispose these carcasses quickly instead of let these dogs to be eat these carcasses. Meat inspection is very important, and that is one of the reason for the rejection of these number of different organs due to the cyst, as I shown you in the yesterday's, and where you can see the liver is a high number of big hydrated cysts. That will be one of the cause of rejection, and so to prevent these feces contaminating vegetables for human consumption, that is one of the source for the transmission of these disease to human, and also prevent the uncooked meat. That is also one of the source for the transmission or zoonotic concern in human. Also, further, this hygienic condition is really important, and I showed you some of the images yesterday from India where the risk factor is high. So these toilet facilities for the field workers, that should be very clean. Treat the peoples who will be travel outside the USA once they come back, if they have any risk of this type of disease, and inspect these meat carefully, because this meat will one of the source for the transmission of this infection in human. Okay, so finally, this zoonotic concern of these cestodes, what we can wrap up here based on each of these cestodes. For example, we started with the Taenia solium and Taenia saginata. So who remember that these two Taenia species, what is the definitive host? Sorry? Definitive host? Sorry? Human. Yes. So it means that disease is not transmitted, human is not become a zoonotic concern itself as a whole, a definitive host. Right? What about Taenia solium? Any difference in the Taenia? We talked about here Taenia solium, human as a definitive host, but anything else? If you remember yesterday's lecture. Human can also serve as a intermediate host, neurocysticercosis. And other than that, Echinococcus granulosis and multilocularis, human is not the definitive host. They can act as an intermediate host. In this case, dogs and cats are the definitive host. In the case of Phyllidium caninum, Spiromatra, and Diphyllobothrum, the human can serve as a definitive host. If you remember, just in this lecture, in the case of this Diphyllidium, we talked about how these arthropods are eaten by the human or children in the case of Spiromatra. So the human can serve as a definitive host in this case. So this is how the zoonotic concern of these cestode parasites look like and how they can infect the human as a whole. Okay, so who has any question?
What's preventing the same type of resistance to causing faunal as like the hookworm treatment? Like what's preventing that? Because I mean we're treating just as much, like the monthly prevention.
So yes, this is a good point. We didn't see any type of presequential resistance in the definitive host, because normally we use in the definitive intermediate host you don't need it, because sheep you need to be, or ruminant you need to be slaughtered. So is not a massive administration, which what our understanding is not like a herd level massive use of drug happening here. So that's why this is one of the reasons that praziquantel is a safe drug at this stage. What our understanding is. But yeah, we're lucky. It's working. Right? Anyone else has any question? Any other query before the midterm? Anything in your mind? Yes. Yeah.
The rapids, is that considered like pre-quiz, or is that in the category of?
My understanding should be the before the quiz 1, between 25%. Anything else? Anyone has any? Anything, any confusion related to midterm exam or anything? No? Okay, thank you.